Let's talk about a medical condition called bronchiectasis today. It may sound complicated, it may sound fanciful, but it's actually a very, very common condition. Probably a name is not given to it very often. All it means is that somebody is coughing up a lot of phlegm a lot of time of the day. Most people ignore the symptoms and don't worry with it, as they don't really feel unwell with it. Some people will only go to the doctor if they've got a fever or if the phlegm has changed color. But actually there is a way to look after it. Why does this happen, and what is the root cause? There are lots of causes for it. Sometimes it's inherited, sometimes it can be due to medication, sometimes it can be due to having had an infection either in childhood like whooping cough or a pneumonia in adulthood. What then happens is that the lung tubes are completely destroyed and secretions from the lung tend to pool in these tubes and infection then sets in. What it usually manifests as is a cough that's there through the day. Patients often ignore it. It's usually the family members or friends or somebody around them who tell them that they're coughing all the time. Have they had a checkup? They don't necessarily feel unwell with it. Some people have deafness with it, and in some patients they have the heart on the wrong side of the chest, which is an inherited condition. It's very easy to look after bronchiectasis, so it's very important that you get a diagnosis to prevent any further deterioration of symptoms. Mostly people who've had tuberculosis will suffer with this condition, but people who haven't had it also will have this condition. It is very important to seek help and to get the appropriate treatment for it. It can be investigated very easily with very simple blood tests, with a chest x-ray and possibly even a CT scan. But the most important test for it is the sputum sample that needs to be cultured, because a bug that sits in the sputum is very, very specific to that patient. There are different types of bugs and different patients have different bugs. It's very important because then you can get the correct treatment and not just be treated with antibiotics like everybody else. And also chest physiotherapy, I think, is very, very important. These emptying the lungs of these secretions is the backbone of this medical condition. Often antibiotics don't work at all. Just keeping the chest clear of all the phlegm in a very easy manner. There are 2 or 3 things which can be done. One is called a postural drainage, in which patients lie in a particular position and phlegm is brought out. Another is just chest physiotherapy, so somebody taps the patient on the back and phlegm comes out. Also cough maneuvers, in which patients are made to cough, helps the phlegm come out. In fact, antibiotics will not be needed at all. What happens if you don't look after the medical condition? The tubes become larger and larger to an extent that sometimes the lungs need to be operated upon to take away that bit of the destroyed lungs. If the infection is kept in control, then none of this will be required. It's a very easy to look after medical condition as long as the patient has had the proper treatment and physiotherapy. It is also important that as a prophylaxis or as preventative that patients have vaccines for this. We have plenty of vaccines these days. We have pneumonia vaccines, we have influenza vaccines. All these will prevent patients getting infection in the chest. I think it's very important to know that these patients are not infectious because they're constantly coughing up. People around will often think that they're infectious to the others. They're not. They're only suffering themselves. It's a very easy to look after condition, and it's very, very important that it's diagnosed at the right time.